Governor Scott has a beachfront mansion in Collier County, and some HIV and AIDS protesters spent the day on the beach right in front of his home trying to get his attention. This is after the state ended a contract that provides health care services for people dealing with HIV and AIDS. And this change means they are now going to have to find other doctors, which they say is an unnecessary burden for them. 4 in Your Corner, Sam Sosa has that story. Sam?
Protesters say this move will disrupt care for nearly 2,000 HIV patients in Florida. One mother tells me if it wasn't for this insurance, she wouldn't be here right now. That's Governor Rick Scott's house in the background.
We came to where we know he might be, and that's his home.
Protesters want him to continue a contract with Positive Healthcare, a provider run by the AIDS Healthcare Foundation that specializes in HIV treatment. In April, Florida Medicaid officials announced they would instead award the contract to different healthcare plans.
They have the right to keep their healthcare.
Imara Kennedy with the AIDS Healthcare Foundation says the move will force people with Positive Healthcare to choose different doctors.
You shift them out of care that covers the doctor that they have had sustainable care with, the doctors that they trust, that it's likely that they won't go back into care.
And without this insurance, I wouldn't be here today.
I asked Melissa Shannon what switching providers would be like. She was diagnosed with HIV in 2003.
For them to take insurance away and try to find a different plan, you won't be able to get the treatment that you need, the extra care, because you have to see a lot of different specialists a lot of times, and the specialists don't take the insurance.
What does the governor have to say about all this? His office says there will still be health care options for those with HIV, even without Positive Health Care. In a statement, they said, it's totally false to say that HIV services are being reduced. Florida's actually doing the opposite. The HIV services this vendor is referring to are being continued and offered throughout the entire state, not just the 3 counties they serve. This vendor's actions have nothing to do with helping patients. This is just about a private vendor being upset that the state will be contracting with someone else to do more for this vulnerable population. Melissa's been living a normal life since treatment and has a healthy HIV-negative daughter who has an opinion on all this too.
Without this health care, more kids like me lose their parents. It's not worth it.
If the contract isn't renewed, changes will go into effect in January, and patients will have to start switching their doctors as soon as 45 days from now. In Naples, Sam Sosa, Fox 4, in your corner.